On the 30th of April, 1961, a 27-year-old Soviet doctor laid down on a table in Antarctica, propped himself up on one elbow, and began performing surgery on his own abdomen. Holding the lamp was a meteorologist. Holding the mirror was a mechanic. Neither of them had ever been inside an operating theater, and the reason this happened is not the one the story usually gives you. Leonid Rogozov was the only physician on the 6th Soviet Antarctic expedition, 13 men at a brand new station on the Princess Astrid coast. Being the only doctor is a specific kind of job. You are the medical system. There is no one to refer to, no second opinion, and no version of the situation in which you are the patient. On the 29th of April, Rogozov woke up weak and nauseated, with pain settling into the lower right of his abdomen. He was, unfortunately, extremely well qualified to know what that meant. Acute appendicitis has exactly one reliable treatment, and it is surgical. Left alone, an inflamed appendix perforates, and infection floods the abdominal cavity. In 1961, in Antarctica, that was simply fatal. He tried everything short of operating. Antibiotics, cold on the abdomen, fasting, and rest. It kept getting worse. Evacuation was not available in any form. It was the polar winter. A blizzard was running. The nearest station was over 1,000 kilometers away, and no aircraft could reach him. There was one surgeon on the continent within reach, and it was him. So he planned it like a procedure, because it was one. He briefed 2 of the men. The meteorologist would hold the retractors. The engineer would hold a mirror and the lamp. The station director stood by in case either of them fainted. Local anaesthetic to the abdominal wall. He had to stay conscious throughout. Then, an incision of around 12 centimeters. He found the mirror almost useless because a mirror reverses everything, so he worked mainly by feel. One hand operating, the other inside, identifying by touch what he could not safely look at. Every 4 or 5 minutes, the weakness and dizziness forced him to stop and rest, then continue. After roughly 1 hour and 45 minutes, the appendix was out. It had a dark patch at the base. It had been close to bursting. He was back on duty in about 2 weeks. In his own account, the detail he lingers on isn't the pain, it's his assistants. They were standing there in white surgical gowns, he wrote, and they were paler than the gowns. He was decorated and became genuinely famous, and spent the rest of his career as an ordinary surgeon in Leningrad. Now, the way this story gets told is as a feat of individual toughness, and it certainly was one. But look at what actually changed afterwards. Antarctic programs started screening for it. In several of them, personnel wintering over had their healthy appendix removed before deployment as a precaution. The problem was never solved by courage. It was solved by a policy that made the emergency impossible in the first place. Rogozov's operation is remembered as one man's extraordinary nerve. It is more accurately a report on what it costs when a system puts somebody 1,000 kilometers from help and hopes for the best. He did note one advantage to the arrangement. The patient, he said, was unusually cooperative.